Hello, my name is Almira. In celebration of Global First Aid Day, I would like to discuss about the relief of choking. We will talk about the first aid steps of relief of choking. So before we get started, I would like to define what choking is. So the definition of choking occurs when the airway becomes blocked by a foreign object, such as what? An example, we have a piece of food or a small toy. What are the signs that we should look for in case you suspect that someone is choking? So we have the sign of inability to speak, breathe, or cough. You would also be hearing squeaking noises. You may notice flushed red skin that becomes bluish or paler than normal. You would also notice that the victim is in a panic state. The most important sign is one or both hands would be clutching on the throat, which is considered as the universal choking sign, as shown in the slide. So what are the steps we should take in case there is a victim that is choking? In case the victim is choking and he or she is an adult or a child above 1 year old, you can simply go ahead and ask them, "Are you choking?" And if they are nodding and not able to speak verbally to you, this is a sign of severe airway obstruction. So the first thing to do is to check for any indications of severe airway obstruction. You can then give abdominal thrusts or Heimlich maneuver to a victim who is either standing or sitting. You can then deliver chest thrusts for pregnant or obese victims. You can go ahead and repeat these steps until effective or until the victim becomes unresponsive. Moving on to choking in infants. Infants meaning what? They are aged below 1 year old. So the first thing to do is to check for any indications of severe airway obstruction, such as what? Inability to make sounds, or if you notice that the infant is turning blue. You can go ahead and give 5 back slaps and 5 chest thrusts. Repeat these steps until effective or until the victim becomes unresponsive. So what happens if your victim does become unresponsive? The first thing you have to do is to activate the emergency response system via mobile device. In UAE, it's going to be 998 for the national ambulance, and it may differ in varying countries. So if you are not alone, you can go ahead and ask someone else to do so to activate the emergency response system. Once this is done, you can lay the victim onto the ground and you can begin with CPR. You can start off by doing the compressions. Before giving breaths, remember to check the mouth for any sort of foreign objects that can easily be removed, and do so. Continue CPR until advanced provider arrives. Thank you so much for listening to this lesson. I hope you understand how to relieve choking in adults, children, and in infants.